The Division of Rheumatology has evolved over the decades and has become one of the nationally and internationally renowned for its accomplishments.
First and foremost, I think it's a program where there is a rare combination of very rich clinical experiences and research opportunities. So that kind of a combination, I think, is unique and rare in itself. And I think that's something that many fellows take advantage of.
You can make of it whatever you want, and you can use it to become exactly the type of rheumatologist you hope to become.
As part of your training, you get electives. So you get around 4 months or maybe 3 months, depending on your track, to choose the elective that you want. They're not set. So if you're interested in pediatrics or more dermatology, ILD, whatever it is that you want, you get it.
The first year is entirely clinical, so all fellows do the clinical year quite identically, and it's split between clinic rotations, the consult service, advanced, and the VA.
At both places you see esoteric cases, and at both places you see bread and butter rheumatology. We see a lot of osteoarthritis. We don't screen those out from our clinic. And some of the other things like rheumatoid arthritis, we see some chronic pain patients. So you wind up doing a lot of procedures at the VA.
You will have experience examining and interacting with patients on your own, both in the clinic and in the hospital. You'll have opportunities to participate in research, whether that's clinical or translational or otherwise. The opportunities are a million for education if you're interested in pursuing educational pursuits among medical students and residents alike. And then in addition to that, we also have several didactics such as immunology, rheumersion, the clinical didactic series, and then of course everyone's favorite, the MSK ultrasound series.
Our fellows, literally their first week of training, are starting to learn diagnostic ultrasonography, and I like to call it, it's the extension of physical diagnosis. So it's as close as you'll ever get to Star Trek with holding, the little probe, and you're looking at the patient, and you can tell them what's wrong, and it's very meaningful to patients to be able to say, they hurt, and you look at their finger and it looks normal to you, and then using ultrasonography that you can actually see synovitis or joint swelling.
There are fellows who have done clinical research mostly, and this can be just clinical research over a year's time, where they do a 2-year clinical program, as it were, and it's a finite, well-defined project which can be accomplished within a year. Or they actually do formal clinical research training, and they do this by pursuing a graduate program through something called the ICTS.
So we have a clinical research training center which has extraordinary graduate degree programs to help faculty and fellows develop skills and competencies in clinical research methods. So we have a Master's of Science in Clinical Investigation, a Master's in Population Health Science, a Master's in Genetic Epidemiology, a Master's in Applied Health Behavior Research. And those kinds of didactic courses make a real difference in speeding people's career development, helping them get career development awards, and transition from career development awards to independent research funding.
I would say that there's 2 general practices for pursuing research. One is you have an interest in a pathway or in a system or part of the immunologic components and pursue that, and the other is inspired by patients. And for me, my research was definitely inspired by patients. So my research in particular has been an overlap between dermatology and rheumatology and some of the cytokine milieu that can kind of facilitate the overall disease process and how that can best be treated. So that's led to presentations, it's led to case reports and series, and kind of pursuing more of the multidisciplinary approach.
By entering into the protected environment of a clinical research fellowship and gaining the formal training and beginning to establish the web of relationships that are necessary to have a strong clinical research career. The fellowship provides an excellent opportunity to get started.
The second track we have is the research investigator track. And that has classically been for people who are really interested in pursuing a career in academic medicine, largely basic science driven. So these individuals complete the same first year as all of the trainees, but then their second year, they're identifying a basic science lab that they then go into for 3 to 4 years and spend the majority of their time doing basic research.
We have world-renowned researchers here at Washington University. They do cutting-edge research, both in terms of concept, but also in terms of technology. The unique aspect of our training program is that our faculty and our fellows interact often, so there's a compassionate side to our program. But at the same time, we understand that we are generating future thought leaders and leading researchers within rheumatology. So there is a rigorous side that allows them to think critically about their work and other people's data. And this is, I think, the glue that makes our program so unique.
I think what makes WashU special is a combination of really severe disease pathology that you're exposed to in rigorous clinical training, paired with the opportunities that we have from a strong basic science and translational science institution, where there's lots of opportunities for you to better understand how the process works, that we better diagnose and treat our diseases and develop new therapies, and think about classifying or reclassifying the diseases that we treat. And so if that is something that appeals to you in terms of rigorous clinical training and understanding fundamental mechanisms of disease, then this is a perfect fit.
So I'm very proud of the fact that we have a very diverse fellowship and faculty. 50% of our faculty and fellows are women. Many of them are underrepresented minority. We aim and strive to be an inclusive division, and we think that that helps with how you learn and how you interact and what type of physician you become.
We have over 100 fellows we've trained now, and they've gone on to do all kinds of amazing things.
We have a unique program here at the Division of Rheumatology in Washington University, and we would very much like for you to be a part of it.